A 10-week-old baby is being released from Children's Hospital today after nearly 2 weeks of treatment for rabbit fever. Carol Hendricks discovered this family in AUP. This infectious disease is rare this day and age, but there has been an increase in cases.
Doctors and experts aren't really certain what really caused this. Maybe because of the weather we've had this year, or maybe because of the population of the rabbit. It's still not known. 10-week-old baby boy has been hospitalized for 2 weeks now. Bacterial infection is clinically known as tularemia, is fatal among children and adults. And it's also called rabbit fever because it typically comes from the rabbit.
Okay, they advise us to have like standard isolation, and then we give supportive care, and then they prescribe antibiotics for our baby, and then they advise us to avoid exposing JC to a place where there's a mosquito, and we always protect him. We changing clothing, and then we use gloves and mask for him sometimes when we go out, and then of course we assure that the water that he drinks is safe.
Tularemia was first described as a plague-like illness that began in 1911 in the United States. A new bacteria infecting ground squirrels was discovered in Tula County, California, hence the name tularemia. This disease affects small animals and is frequently associated with sick rabbits, which is why this disease is also known as rabbit fever. You could be infected by being bitten by blood-sucking insects such as ticks, deer fly, and handling meat and skins of infected animals, food and water that's contaminated, and breathing in the bacteria. Cases of tularemia happen naturally in the environment. However, cases of tularemia has been studied in a laboratory setting as well. Tularemia is not known to spread from person to person, but it has been studied as a biological weapon because it could be used to contaminate food and water, and it doesn't require many organisms to infect a person. As a use of plague, Japanese used tularemia in a biological warfare program. General Ishii used it in experiments against people in Manchuria before World War II. Their goal was to create ways to infect as many people at one time. Historians estimate that over 200,000 Chinese were killed in germ warfare field experiments. World Health Organization estimated that 50 kilograms of tularemia spread through the air over the city of 5 million people would lead to 250,000 cases of illness, and 19,000 of these sick people would die. In 1994, tularemia was removed from the list of diseases that doctors required to report when they occur. Because of the potential danger tularemia exposes to mankind, it was placed on the reportable list of diseases in 2000. Tularemia is classified as Category A agent, which is one of the critical agents of concern about terrorism perspectives. Tularemia was included in the U.S. stockpile of biologic weapons in the late 1960s. Dr. Ken Alabin is a Soviet Union weapons defector who provided much information about the biological weapons program in this country. It indicated that his country and the United States held similar studies trying to engineer tularemia strains that would be resistant to antibiotics and vaccines. The United States ended its development of such weapons in the early 1970s.
Tularemia is a severe, often lethal disease caused by the bacterium Francisella tularensis. The bacteria typically affects small mammals such as rabbits. Due to its ability to spread through the air and quickly infect and kills humans, it is also considered a potential agent of bioterrorism. Inhaling about 1,000 of microbes, which will be smaller than a grain of salt, will result in a life-threatening infection. Once Francisella establishes itself deep in the lungs, it infects and manipulates the powerful immune cells called the macrophages. The bacteria disables the macrophages and replicates freely inside the cells. The bacteria also has the ability of the cells to signal other immune cells for help. Eventually, the bacteria moves out of the lungs and spreads to other organs, continuing to replicate until the organ is destroyed and the host dies. In humans, the process of infection to death only takes about 7 to 12 days.
Tularemia can be treated and cured with antibiotics. However, the complex invasive nature of this bacterium often prevents timely diagnosis. Scientists continue to learn about Francisella, and they're exploring new ways to protect people from infection and disease. For example, NIAID researchers are studying an experimental treatment that stimulates the immune system to destroy invading Francisella microbes. Researchers have successfully tested this therapy in the laboratory and in mice, but much more study is needed before it can be tested and effectively used in humans.
Welcome back to Health Daily. My name is Nickie, and here we have two guests, Dr. Atienza and Dr. Musema, who will be discussing with us about tularemia. How quickly would someone become sick if he or she were exposed to tularemia?
Okay, if you suspect that you're exposed to tularemia bacteria, you should see a doctor immediately. Treatment will be given with antibiotics for a period of 10 to 14 days or more. If you suffer exposure, treatment may be recommended. If you're given antibiotics, it is important to take them accordingly. Especially, you need to follow the instructions given by the doctor precisely. And all the medications that you're given must be taken.
Can someone be infected with tularemia bacteria from another person?
People have been known to be in close contact with other people, but they have not been able to transmit infection to others. So I would say that isolation is not needed.
Is there a vaccine available for tularemia?
Well, a vaccine was used to protect laboratory workers in the past, but currently the vaccine is not available.
What should someone do if he or she suspects exposure to tularemia bacteria?
Well, if you think that you're exposed to tularemia bacteria, as with all diseases, I would recommend go see a doctor.
How long can Francisella tularensis exist in the environment?
Well, Francisella tularensis can be alive in water or in soil for weeks.
What are the signs and symptoms of tularemia?
Well, the signs and symptoms depend on how the person is exposed to tularemia. Skin ulcers, swollen and painful lymph nodes, inflamed eyes, sore throat, mouth sores, diarrhea, or pneumonia. If the bacteria is inhaled, the symptoms will include abrupt onset of fever, chills, muscle ache, joint pain, dry cough, and progressive weakness. But if the person has pneumonia, there's something else. They can develop chest pain, difficulty of breathing, they can have bloody sputum, respiratory failure, and tularemia can be fatal if the person is not treated with appropriate antibiotics.
How is tularemia diagnosed?
Well, when a person has the signs and symptoms that appear to be tularemia, the healthcare worker will collect the specimen, such as blood or sputum, for testing. In a diagnostic or reference laboratory result, for tularemia may be presumptive or confirmatory. Presumptive and preliminary. Identification may take less than 2 hours, but confirmatory testing will take for more than 24 hours, which is between 24 to 48 hours. or longer depending on the method used. Depending on the circumstances, a person may be given treatment based on symptoms resulting to be before the laboratory tests are returned.
Why are we concerned about tularemia being used as a weapon?
Well, tularemia is highly infectious. A small amount of bacteria, about 10 to 50 organisms, can cause the disease. It is used as a weapon. It will be airborne, so they could be inhaled by people who inhale the bacteria, and they can experience severe respiratory illnesses, including life-threatening pneumonia and systemic infection if they are not treated well.
Are they going to talk about tularemia again?
Francisella tularensis, deer fly fever, marketman's disease, rabbit fever. Oops!
Are you talking about tularemia?
Yeah, it's an infection caused about Francisella tularensis found in animals like rabbits, rodents, and hares.
Really? How will you know if you're infected with tularemia?
Well, you'll be having a sudden
no,
fever.
That's very common symptoms. How does tularemia spread?
By simply handling infected animals.
That's so alarming.
Yeah.
I think we should be careful on how we're exposed. I'm afraid I might get infected too.
Yes, you're right.
What do we do?
Wait. You should see your doctor. It's the first time of illness.
Really?
You must get blood cultures.
Is that so?
X-rays. Yeah.
Okay.
Standard isolation are recommended, and also supportive care, such as avoid drinking untreated water, use gloves, mask, eye cover when handling wild animals, avoid ticks and mosquito,
That's right.
though protective clothing repellents.
Yes, thank you so much for your help. I think I'm ready.